Hi again, and welcome to Pearl Magazine. As the coronavirus spread through Hong Kong at the beginning of the year, many people who felt ill were unwilling to risk even a visit to the clinic or hospital for fear of the virus. Luckily, in today's world of remote working, patients could still see doctors through online and mobile platforms or telemedicine.
Well, in many countries, telemedicine apps linking patients to doctors via mobile phone or notebooks have been in use for years. But in Hong Kong, it's just being rolled out now. The virus has pushed faster adoption of these services, which make it more convenient, virus or not, for patients to see their doctors. Watch this.
Imagine you're staying at home and your doctor will be seeing your vital sign in a real-time manner while he's seeing you.
So if I wear this all the time, then they can always check and see if I have any spikes?
Yep. You can share all this record to your relatives. In case of for elderly or you have some chronic disease, your doctor or your nurse may not be seeing you 24/7 around the clock. But with this kind of wearable device, they'll be seeing you and you can share all your data.
Telemedicine, or medical consults through telecoms platforms, which include video and audio, through your phone or laptop, has been around for many years. In 2018, telemedicine picked up lots of traction overseas as medical councils set up guidelines for practitioners to follow. In Hong Kong, guidelines were set up by the Medical Council in December of last year. Dr. Daniel Tong, head of the Hong Kong Telemedicine Association, set up his group several years ago to link doctors with IT experts so they could work together on what technology doctors needed to help their patients. But their remit has expanded to raise issues that need to be addressed in the guidelines.
We found, we are sort of the activities holding up by the regulations. If you say a doctor want to use this technology, but then it's limited by the regulation. Deliver medication is held up by the regulation. Can we ask those who set up the regulation, can we change this? Which kind of medication can we deliver, and to what extent can we do it safely? We don't want to break the rule, but then we want to provide the best service for our patient. And these patients, we are one of them in future, and near future.
He says telemonitoring is another big area of development, which goes hand in hand with the currently new consulting platforms in Hong Kong.
Some cardiac disease, you just by careful monitoring can reduce the mortality rates without any change of medication, without the death rates, more than 30%. It's research based on data from a university professor developed locally. Why can't we implement all this? We just need to gather all these people together, let the government know, please change, and we're going to improve build a better future.
Chi Man Lam, founder and CEO of a company that develops telemedicine platforms, currently has a free app where users can check their skin, teeth, hair, and eye health.
We want to move people's concept and minds from sick care to healthcare. So by simply taking a selfie, our app will be able to help you to diagnose some premature syndrome or disease.
He's currently working on an app for a large group of clinics to work hand in hand with an insurance company. The application allows you to book your appointment, have your consultation, get your prescription, referral letter, and even has a delivery service for the latter if a patient is unable to pick them up. The cost of consultation is the same as if you go in person.
We launched a pilot program since early April to test that whether this is an option, for the patient that's covered by insurance, that will they choose an online option rather than going to the clinic. Because the guideline is pretty new still to the doctors, and the doctors are very conservative, want to stick to, the clinical governance, very much. We can see that those patients have a busy schedule. They just have 5 to 10 minutes, do not even have the traveling time, and video consultation to them actually is a good option.
Wendy, whose company is part of the pilot scheme, tried it. She prefers not to be seen.
The doctor was patient and asked detailed questions. It took us around half an hour. The doctor was friendly, even asked if I needed a sick leave letter or referral letters. But the most amazing part is they have a delivery service. When I paid online, they quickly sent me a confirmation email, and the next day, they delivered the medicine to my office. The whole process saved me a lot of time. Because I work 9 to 6, and if I want to take one day leave to see a doctor, I have to find someone to take care of my work. Now I get to see the doctor face to face in about 10 minutes through their online channel.
The clinic's pilot scheme currently includes 20 doctors and 20,000 members in corporate insurance plans. Both the clinic and insurance companies say they're still learning what their clients want.
Our plan was to launch that sort of Q3 or Q4 of this year, and then coronavirus came along around Chinese New Year. So we very quickly found a partner in Quality Healthcare and have launched our telemedicine service with them back in April to a relatively small proportion of our customer base.
Is there a particular profile, would you say, of those who are using it more?
Probably our customers under 45 have probably been the early adapters. During the COVID situation, people didn't really want to go into clinics. They didn't want to go and see their GP, they were scared. This has given people another avenue, not just a convenience, but also a safety angle for them to play.
The clinic group is also working with the government to handle some of the PCR testing for the virus.
The government is providing PCR tests free to all patients have a symptom. So we choose to provide an easier option for them. They don't need to go to the clinic, but we can pick up the sample and they drop it back to the government center. People are screened once out of their airport or going to the public hospital. We are supporting this program very much, to either collect the sample in our clinic physically or provide a video consultation. So to collect the sample, from the patient at home. The major objective is to give people ease of healthcare, so they don't necessarily walk out of their home, especially if they suspect they are not feeling very well.
With telemedicine, patients can choose whether or not to come into a clinic by using one of these with their doctor. They can even have their medication picked up or delivered. But the medical community is still hammering out the details of what can and can't be done through remote consults.
Even without formal applications, many doctors are already adopting telemedicine using existing video conferencing platforms. Dr. Joyce Lai, a GP, says COVID-19 really kept her patients from coming to see her. So instead, they saw each other over existing online platforms.
I started telemedicine in my clinic around January when COVID-19 started. And since then, more and more patients have tried it, liked it, and at one point, I think I transferred almost all my patients online. I think it really works for a lot of patients, especially those with chronic conditions, those parents who have to homeschool, the busy workers, and even some who just prefer to be at home because of safety and health reasons.
Bosun Hao was one such patient. He had injured himself during the height of the coronavirus pandemic in Hong Kong and wanted to avoid contact with other people as much as possible.
Back in March, I had stubbed my toe and at the time was very much concerned, I think, given COVID. Clearly, the toe was not in a good shape, and therefore, we thought that the best thing for me to do was to at least get some physician kind of consultation on it.
It could be fractured, it could be dislocated, but we can speed up that process faster by just directly bringing them straight in to get an x-ray to get it done. It saves time from them having to come in for a consultation, and therefore we can just immediately see online what the results are and redirect them if necessary.
I would ask Stephen questions about, look, which imaging center would you recommend? And she had provided a number of options and said, these are perhaps the ones that we are aware of that are taking, kind of the utmost precautions.
Dr. Lai says telemedicine does have its limitations since there are certain things you can't do over video, such as anything using instruments.
For example, I won't be able to do a pap smear. I won't be able to take blood or take any bodily fluids, for example. There are newer companies trying to create new apparatus which is directly connected to a phone or directly connected to the office so that we can see particular smaller orifices, which normally would be much easier to see when you're in face-to-face. So even with ECG, with stethoscope, I think technology is evolving. We're just moving with the times. It's a fluid situation.
Dr. Tong agrees. There is still room to grow with new technologies being developed. Not only do these new technologies save time, they also save money. He says a study done back in 2008 in Shatin showed that using cameras together with consults for a group of institutionalized elderly brought costs down by a whopping 90%.
They save a lot of resources, time, manpower, and the calculated cost is just 1/10 of the medical costs spent.
He says it's important to adopt new and tested technologies and move quickly to create guidelines and regulations, which could ease some of the deficiencies in the health sector.
Facing the aging populations, the demands increase. I would like to see, using the telemedicine, we're not talking about shortage of doctor. Instead, we increase the efficiency of the doctor and the healthcare system. We're not talking about money. Come on, you get a lot of technology to overcome this problem. And if the technology can help, let's use it. And you're not talking about we need more doctor. You need acceptance from the doctor side, from the patient side, and the whole society as well. But I hope people open their eyes.
As Hong Kong's population ages, children are having to juggle childcare with parent care.
A nanny for Granny? How children are finding ways to care for their elderly parents when Pearl Magazine returns.
Welcome back. Parents, especially working parents, often find taking care of young children time-consuming and energy-sapping, and they hire a nanny to help.
But when parents grow old, they are the ones who need taken care of. As our old age population grows, being a nanny for the elderly has become ever more important.
As people age, health issues pop up, and old folks often have to visit the hospital.
我有唔同嘅病啦，有青光眼啦，有哮喘啦，又有精神病啦，有血壓啦咁。
電話話俾佢知幾時呢個覆診咁，佢就安排㗎啦。幫我推輪椅啦，幫我輪藥啦。
These people taking the elderly to see their doctors are not their family members. They're volunteers.
I am Quan Lai Ying. I am doing an undergraduate degree in primary mathematics. I will be a teacher.
Vicky is a Year 4 student at the Education University. On this day, it's only 12 degrees outside, but she has to get up at 7 a.m.
Let me see. It is 7:48. The earliest class is at 8:30. I haven't been to an 8:30 class in a long time.
Vicky started volunteer work when she was in Year 2. Her task involved mostly taking care of children. She began to realize the importance and meaning of accompanying older people to clinics and hospitals.
我係今日義工啊，去關麗瑩啊。你而家嚟緊啊？係啊，而家搭緊車。好啊，咁我哋一陣見啦。
We are going to pick up an old lady at an elderly home in Sampo Kong to bring her to the Evangel Hospital and then bring her back. From Tai Po, I need about 1.5 hours. I expect to get to the hospital by 10 o'clock. But I have no idea how long we need to wait at this private hospital. Queues at public hospitals are usually very long. Initially, I was not interested in taking care of the elderly. I was interested in kids. But my teacher told me low-income elderly really need volunteers to escort them to see their doctors. Some even need to pay for escort services, despite not having much money. I sympathize with their troubles and think this job is very meaningful.
Granny Pak stays at the elderly home and rarely ventures outside.
我哋出發啦！三行都係撳住落掣，唔好放手，唔好放手。好。呢個 lift 我真係第一次用喎，呢個。過到醫院啦，司機哥哥唔該，你唔想嚟啊？我想，睇一陣。
I can't take care of myself. I need a caretaker to visit the clinic. I have many illnesses like glaucoma, asthma, mental disorder, and blood pressure, so I frequently go to the doctor. Regular caretakers cost $360 to $370 per visit. That's enough to visit doctor twice.
Nowadays, it's rare for young people to spend time with elderly people outside their family. Granny Pak thinks of Vicky as her granddaughter. She feels very satisfied whenever Vicky visits, even for just a walk.
Students like me may not have time for this, but whenever the circumstances allow, I will help.
If they can accompany me for a walk or get something to eat, I would ask them. Being happy is the most important thing in life. Going for a walk makes me happy.
As Hong Kong's elderly population grows, demand for volunteers is also rising.
Today I will go to Tung Tau Estate to fetch an old gentleman to the outpatient clinic at Queen Elizabeth Hospital. I will meet him at 1:15 p.m. but I need to depart at 11:45 a.m.
Yung Siu Kao is also a volunteer. He visits old people 3 to 4 days a week. Today he woke up early to bring the elderly man to a clinic, but he has never met the person before.
Unless I have been to the place many times, I need to check it out first. Because I'm not familiar with the area, I don't know the location. I worry they will be late for their clinic visit.
Hey, 唔係噃，我姓容㗎，今日同你去覆診啊。哦，今日覆診啲乜嘢啊？今日我都唔知啊，你俾張覆診紙我睇啊。哦，日間呢度有6樓2點，係啦，呢張係啦。
80-year-old Tin K lives in Tung Tau Estate alone. He only has a few relatives in Hong Kong, and he seldom sees them. So volunteers will take Tin K for a walk or bring him to follow-up visits in the hospital.
嗱，你等下先啊，我攞咗出去先。有冇帶銀包？帶咗啦，嗬。帶咗。係啦。帶鎖匙未？
Young has been taking old people to clinics for more than 10 years. He says the escort service seems very easy, but it requires some skill.
Usually old people have some mental issue because they are lonely. So a volunteer's job is to talk to them.
好，非常之好啊！嗱，慢慢啊，坐喺呢個位啊，唔好再喐啊，坐落去，睇頭。而家你一個人照顧自己有冇困難啊？暫時又冇，暫時冇啊！朝頭早起身就好辛苦。哦，即係咪企唔到啊？企唔到啊？定係去第三啊嘛？拍立機都有啊嘛，拍立機呢個普通科長期睇醫生嘅又係。
Elderly people like Tin K who live alone need more than just physical assistance from volunteers, but also their psychological and mental support.
打電話話俾佢知幾時呢個覆診咁，佢就我咩安排㗎啦，幫我推輪椅啦，攞藥嗰時幫我攞藥啦，佢幫我 check 下睇我有冇錯漏咁。
Between going out to eat and returning home, the elderly spend most of their time on medical visits. So there's a need for escort services. The Social Welfare Department says right now more than 10,000 old folks are queuing up for such community services. Among them, more than half are asking for escort services. The average waiting time is 13 months. Some private services charge as high as $160 an hour, which is more than 7 times the public sector fees of $19 per hour.
大家參加我哋今次嘅義工嘅培訓工作坊啊，咁啊今次咧就好好啦，天氣又好啊，咁啊參加嘅人咧亦都相當多。
The NGO organizes a workshop every month. Here, experienced volunteers share with the newcomers what they've learned as volunteers, hoping to get more people involved helping the elderly.
你哋以後就有機會去譬如探訪長者又好啊，帶長者活動都好啦。其實你自己係得真係好多得着㗎。佢一講起個女咧，佢就喊㗎啦。咁佢就好唔開心。但係當然，如果佢自己講咧，我有得去講嘅。收嘅時亦都好簡單，兩手指。
Joseph Au has been in social welfare for over 30 years. He says most of the volunteers are older themselves. Au hopes more younger people can volunteer.
We
have about 60 to 80 regular volunteers. Most of them are older people. Not many young people in the group. Most youngsters prefer the group services. In the future, we plan to train up young people. Every year, we invite universities and secondary schools to take part in our volunteering work. We will send our staff to train up the students at the schools.
Next week, we look at how young art students turn their university projects into something that benefits the elderly.
And what does the future of flying hold for travelers as skies reopen for business across borders? That's the show. Thanks for watching.
Good night.